Fellow caregivers, for several months we have observed the COVID-19 pandemic nationally and internationally. We have seen hospitals experience different peaks in patient activity. At Cleveland Clinic, we're studying all of this to guide our approach. We feel we can never be too prepared. Therefore, we're planning for the worst-case scenario. Our surge plans involve staffing, supplies, and space to care for the greatest number of patients in need. These plans cover all Northeast Ohio and Florida regions. Here in Cleveland, we have been converting the health education campus into a temporary hospital. It is a true team-of-team effort. Clinical and non-clinical caregivers are all contributing to this monumental project. Today, I had an opportunity to visit the campus and see progress. Let's take a look. So we're here at the health education campus that has been transformed, and I'm joined here with leaders who are responsible for a transformation. Would you mind just please introducing yourself?
I'm Dr. Rita Pappas, the Chief Medical Officer for the Health Education Campus Surge Hospital.
I'm Rob Stahl, and I'm the Chief Operating Officer for the Health Education Campus Surge Hospital.
And I'm Shannon Pengel. I'm serving as the Chief Nursing Officer of the Health Education Campus Surge Hospital.
Rita, can you tell us a little bit more about what we're trying to accomplish over here?
What we're trying to accomplish is to open up the ability to surge to 1,006 beds in a space that's been transformed from a learning environment into a clinical field hospital. And it really had to do with preparing for the worst and anticipating the surge. And so when our executive leaders were looking, the site that was chosen here at the HEC was resulting of the close proximity to main campus and the ability to flex our caregivers and move patients safely.
Rob, this looks like a phenomenal undertaking. What did you and your team needed to do in order to make this transformation possible?
We have had 65 different trades working on this around the clock, about 100 people on average every shift. We have put in oxygen into a building that did not have oxygen. There are 6 miles of medical copper tubing. We are putting 327 beds on the first floor. Everyone has chipped in and has really been working towards putting this together. And our goal is to have this ready to go by April 15th.
Obviously, what Rob just described is a remarkable effort in putting the infrastructure here. Nothing can happen without caregivers. So can you speak a little bit about the preparation for our workforce, our caregivers who should be providing care here in this space?
So we have a multidisciplinary team that's really working on clinical workflows, patient navigation workflows, even down to our safety procedures for our patients. They're actually up on the 3rd floor, right here in this building, talking about what they think will work and then going and walking the space and making sure what we have in theory will actually work when we're providing care. We're to the point now where we have a playbook built, so anyone that comes into this building really will be handed a playbook of every procedure, from how they enter the building, how they don and doff their PPE, how they go take their breaks. So we're really anxious to have the building fully operational so we can come start testing some of these workflows with our caregivers that will actually be in this space.
Rita, when we speak about this large space for very many patients, who are the patients who we envision are going to be here?
Yes, so they're going to be COVID positive patients who are on, the maximum would be 3 liters of oxygen. They need to be ambulatory, so to be able to walk around the building safely. And we're really thinking about our caregivers, and so the caregivers have to be in PPE longer than current workflow as it is today. The caregivers that we have are volunteering, just like they always do, and they are in spirit with us, walking step by step.
Rob, what was the biggest challenge and how did you manage to overcome that?
So I think the biggest challenge was the oxygen, because oxygen is absolutely critical to this cohort of patients. In order to have those patients here, we've been putting safety first. We have done everything from taking all the microwaves out of the building to making sure that there are opportunities for us to practice actual evacuation of these patients.
It's an immense amount of work, but what I was particularly struck by, Shannon, is when I took a look at our caregivers, nursing, physicians, engineering, they're using these big white boards to capture their ideas and develop concepts. Could you just speak a little bit about the work process that, when we kind of start to work together as a team, allows us to do something at this scale, this fast, and with such a degree of excellence?
Yes, you know, I have to give credit to continuous improvement. They have been just integral in this process of developing these workflows. But it's really amazing to see all the caregivers you mentioned coming into one room and talking about everything they need to complete a workflow from beginning to end. Again, from providers to the lab to pharmacy to facilities. Even how are we going to, you know, bring facilities in to do repairs once the hospital is operationalized? So this open sharing of ideas, we need to figure out what's going to happen in that what if. I think one of our mottos is we develop the workflows together, we train together, and we activate together as one team.
So when we started this effort, our goal was to be over-prepared. We never want to be in a position when we're catching up with the disease burden or needs of our patients. We want to be prepared for them. So this is one of our shining examples of the preparedness that Cleveland Clinic has to combat the pandemic. If you were to take a look at the lessons that you are learning, acquiring in this process, what are the lessons we can take in the future?
Of all the places I've worked, both overseas and here, I walk away always impressed how people pull together. This is an organization where people can't do enough. I have been incredibly impressed by what has happened over these past 2 weeks.
Yeah, I think the interdisciplinary teams cannot be overlooked. Bringing everybody together and talking about every possibility, I think, has been a huge key to our success.
And I think one of the major lessons that I learned early on, leaning on other healthcare providers. So for instance, I reached out to Becky Stark and said, you opened a hospital, share with me please. And it was instantaneously, she sent me an email of all of the training and all the planning that they'd done.
Yeah, that's wonderful. You just shared with me, Shannon, that you have developed a name for this hospital. Would you mind sharing it with us?
Yeah, so one of our caregivers, Dr. Khatri, wanted something inspirational. We wanted patients to have a sense of comfort when they arrive through our doors. So I think the discussion was around, should we rename this the Hope Hospital?
Oh, that is absolutely wonderful. So this is a Hope Hospital of Cleveland Clinic. And as I'm kind of looking at our health education campus, the motto in the center of the courtyard, what can be conceived, can be achieved, cannot be more timely than it is today. Thank you again for all that you do, and to your teams for doing something that is absolutely incredible in a short period of time. Thanks again.
Thank you.
We're grateful to Case Western Reserve University for their partnerships and support on this project. As we care for more patients, our plans may change. When they do, we will keep you informed. We cannot over-communicate with you. By staying flexible, you are what enables our response. We are making progress every day, and it shows. Through teamwork, innovation, and compassion, we're demonstrating the very best traits of Cleveland Clinic. Thank you for everything that you do.